All right. Well, welcome everybody. Have we got a show for you today? We have an amazing lady fresh from the 1800s on the phone with us today to help us learn about her. You'll never guess who it is.
Yay!
Yay! Tell us who
Tell us
it
who
is.
it is.
Well, let me give you a little background first. This lady with the lamp was given her name from the place she was born, Florence, Italy, in 1820. She was born to a wealthy family and was well educated. Her rise to fame came after she helped wounded soldiers during the Crimean War. She also wrote a book, Notes on Nursing, What Is and What Is Not, and she also founded the first nursing school in Europe called the Nightingale Training School. Have you figured it out?
Florence
Florence
Nightingale.
Nightingale.
That's right. All right. We have Miss Nightingale on the phone with us today, and she is ready to answer questions regarding her life and nursing practice.
Thank you all for having me. It is a pleasure to be on the phone with you today. Please call me Flo.
Hi, Flo.
Hi, Flo.
Hi, Flo. All right. I don't want to take up too much of your time, so let's get started.
Flo, our first question is, in the face of opposition from your family, you decided to become a nurse instead of a wife and mother. What called you to do so?
Well, to be honest, it did not sound fulfilling at all to me to become a wife and a mother, and I felt compelled to care for others. Excuse me, guys, I'm having a little bit of the Crimean flu. Um, Even as a young child, I took care of the sick and the poor people, even though my family was wealthy and it was frowned upon for people like me to have labor intensive jobs. I really, I really just wanted to help those. I hear little children running in the background. I think,
Ah, I'm so sorry. I tried to cover the mic, but I guess you guys can still hear it. I'm in the interview room, and there's a daycare in the background, so you guys just keep going. I'm sorry, Flo. Continue to what you were saying.
oh, no problem. Thank you so much. I just love the sound of children running in the background. Sounds like healthy little environment. Although So anyhow, I just, as a young child, speaking of, I would really love taking care of the sick and the poor people. Even though my family was wealthy and it was frowned upon for people like me to have labor-intensive jobs, I really wanted to help those that needed me. I don't really look at nursing as labor-intensive or a second-class job. Rather, I view it as doing good for the people. I think my background may have helped improve how the nursing profession is viewed.
So, Flo, the second question, I admire the fact that at a young age you realized what your purpose in life was. Being confronted with obstacles and opposition, did you ever question your pursuit in nursing?
Well, let me think on that for just a second. Really, no. When you know with all your heart what you are called to do, you also believe that God will give you the strength to pursue it. Most things in life worth having, they don't come easy. Allowing your faith and determination to lead you keeps you focused.
Well, that's really interesting. How did you handle being a nurse in a war zone?
Well, like I mentioned earlier, I was born wealthy and my family did not want me to be a nurse. So when I decided to become a nurse, it was not because I thought it would be a good job to make good money or that it was respectable and I'll be able to tell my friends how great I'm doing in life. I saw a need for nursing and wanted to fill it. I wanted to do my part to contribute something to the world that made me feel I was here for a reason. I mean, I guess being in a war zone and treating the wounded was something I felt I could do to help. I had known how to follow commands due to my upbringing, but I also knew how to give them. So I used this in my practice. There were not many nurses when I started, so I had to use my skill and personality to recruit and train new nurses to help me.
Wow, really? That is amazing, Flo. The next question we have for you is when you started in the first Nightingale Nurses Training Program in 1860, what did you think the future of nursing would be?
Well, I saw the future of nursing to be challenging and innovative. I wanted nursing to remain an admirable position, one that provided quality and safe care, one that evolved with the changes in medicine and that included nursing input in relation to patient care. And really, I wanted nurses to remain humble and compassionate in the care that they provided.
Well, that's really admirable. Um, well, do you think that being a nurse at that time made you a better nurse?
Well, excuse me for just a moment. I do believe that my experience in the Crimean War has helped me to be a better nurse. I had to treat many young men who had been wounded in the war, and to do this with very little resources. This experience helped me to hone my skills in assessing and observing the emergent needs of my patients. This is especially true with those in pain and suffering. I knew in order to evaluate their needs, I needed to address their pain. I also knew that in order for proper healing, my patients needed adequate nutrients. I developed this knowledge and the skills I have in the field, and now I'm able to teach others what I know.
Another question for you, Flo. In your environmental theory, you emphasize the importance of the condition of the environment in relation to health and wellness. Can you elaborate more on its significance?
Well, yes. So the physical and the psychological components of a person, they're interrelated. And in order for therapeutic healing to occur, an atmosphere of comfort must be created. Just as a person who isn't comfortable may not get adequate rest, a person who's ill, who isn't comfortable, may not heal effectively.
Wow, that makes a lot of sense. So how do you feel about some hospitals or units having any guidelines or limits to visiting hours? Are one of the main points in your nursing theory is that patients should get proper rest and have a quiet environment to heal?
I think it is so very important to involve friends and families in the healing process of the patient. But at the same time, I think that we've gotten a little bit off the track of what patients really need from their environment to properly heal. Clustering care is not very common in the hospital setting at a time when the patient is trying to rest, especially at nighttime. And it can prove to be a very difficult task because there's still meds to be administered and vitals to be checked. And if I'm not mistaken, you have tellies in the patient rooms. I feel this is not the best environment for the sick as it could compromise the healing process with all the stimuli it provides. Really, I feel that we need to keep the patient's healing at the forefront of our minds when treating and limit the amount of extra activities during the healing process.
Well, on a side note, how do you feel about the relationship between doctors and nurses today?
You know, I just am so proud of how the nurses have become more independent from the doctors today. I feel as though nurse practitioners and stuff like I really support that new role that's out there. And I just
Hmm.
really want to encourage other nurses to further their practice and to be more independent and functional on their own.
I agree.
You know, I just really like that the doctors and nurses have come so far, and there is such a big respect between the two professions.
All right. Well, Flo, I know you're a busy lady and I want to let you get back to your work. I truly admire you for doing what you did, especially in the time period you did it in. So thank you for giving us a little insight into your life.
Man, thank you for having me, and you guys all have a wonderful night.
Thank you.
Thanks, Flo.